Good evening, this is Ajahn John. This evening I have a student with me who is a doctor. He specializes in gynecology, so I'm going to ask him what a gynecologist does.
Yes, the gynecologist take care to female health, such as when she have the abnormal bleeding from her vagina, or she had leukorrhea. I will take care of her.
So my student says he will take care of women when they have some health problems, such as abnormal bleeding from the vagina or other things. So now we are going to look at a USMLE case. USMLE, this is the nickname commonly used by doctors. USMLE, the United States Medical Licensing Exam. This is an examination which all doctors need to take if they want to practice medicine in America. The part of the exam we are going to do here is where the doctor is confronted with a patient who has a particular problem. The doctor is then going to take a patient history, do a physical examination on the patient, but excluding any internal examination or breast exam for females. Then the doctor is going to explain his clinical impressions and further test procedures he wants to do on the patient, and finally he is going to write up his clinical notes. Now in this exam the patient is not a real patient, it is not a sick person but an actor, but they have been trained to exhibit appropriate symptoms and also to answer the medical history questions. The doctor, of course, should behave as if this were a real patient and be careful to perform their duty in an appropriate and professional manner. So, for example, they should be careful to look the patient in the eyes when they are asking questions, introduce himself and also identify his position as a doctor, use the patient's name correctly, and before entering the room where the patient is, to knock on the door. So the patient here is Patricia Garrison, a 36-year-old female who comes to the doctor complaining of not having had menstrual periods recently. These are her vital signs. Her blood pressure is 120/85, temperature 36.7 centigrade, respiratory rate 13 per minute, and heart rate 65 per minute regular. So I'm going to play the part of the patient here, and the doctor is going to ask me medical questions. So as I have said, the patient has not had menstrual periods for some time, so now the doctor is going to ask what he thinks are the appropriate questions.
Hello, I'm the Dr. Kisada. I'm the obstetric and gynecologist. How are you?
I'm okay, doctor, but as I said, I'm having this problem that I haven't had any periods for a while.
Yes. How long you didn't have your period?
How long, best to say here is, how long is it since your last period? That would be the better grammar here. How long is it since your last period? I haven't had a period in 3 months.
3 months. Okay, you have no period for 3 months. And now, in the previous period, have you had the regular period?
Best way to ask that question is to say, before 3 months, were your periods regular? So I think grammar is quite important when you're taking patient history. So before 3 months ago, were your periods regular? I used to have regular periods every month lasting for 4 or 5 days, but over the last year I started having them less frequently, every 5 to 6 weeks and lasting for around 7 days.
And do you have the other symptoms such as nausea, vomiting, or breast tenderness?
So let me just correct the doctor's grammar here. Do you have any other symptoms such as nausea, vomiting, or breast tenderness? No, I haven't had any of those symptoms.
Okay. Have you used the kind of birth control?
The question there should have been, are you using any kind of birth control? That question is okay, and my answer is I have been taking the same pills for 8 years. But I would like to mention here that maybe the doctor should ask first if the patient has a sexual partner, because of course she cannot get pregnant if she doesn't have sex. If the doctor did ask the question, do you have a sexual partner, the answer would be, I have sex about once a week on average with my husband.
Okay. Yes. Do you use the medication or any drug?
The question there should be, are you taking any medication or drugs? Now, I would like to point out here, if the doctor is also referring to illegal drugs, then he needs to specify that. So the question would be, are you taking any medication or illegal drugs? And the patient's answer to both these questions is, no, I'm not taking any medication and I have never taken any illegal drugs.
And how about your vision? You can see some clear vision.
Is your vision normal, or is your vision clear? And the patient's answer is, my vision is normal. Actually, it would be better to ask the question like this: have you had any visual changes? Because the patient may normally have some kind of visual problem, and the doctor's intention here is to find out if there have been any changes in her vision.
And now, how many children do you have?
I have one child. He is 10 years old. But it would have been better to ask the question, do you have any children?
Do you have any children? And when you are pregnant and you got the delivery, there are some problem while your delivery, such as the postpartum hemorrhage, or you got the curettage in your uterus.
My pregnancy and delivery were normal. Doctor would be better to ask the question this way: was your delivery normal? Did you have any problems during childbirth?
Okay, please describe your period to me again.
I used to have regular periods every month lasting 4 or 5 days, but over the last year I started having them less frequently, and now every 5 or 6 weeks, lasting for around 7 days.
How about your amount of your pad when you have the period? Your use when you have the periods?
I use around 2 or 3 tampons per day, but the blood flow is becoming less, and nowadays I usually only use 1 a day. When the doctor is trying to find out about the blood flow during menstruation, probably best just to ask how many tampons do you normally use per day during your menstruation.
Okay, are you healthy, or you have some kind of other disease such as the hyperthyroid or something like that?
I don't have any kind of diseases either now or in the past. The best way for the doctor to ask this question is, do you have any underlying medical problems, and have you had any in the past?
Okay, do you have the abnormal breathing from your vagina while you have the sexual activity?
No, I don't. Again, the best way to ask that question would be any unusual bleeding before, during, or after sex.
Yeah. Do you have the pap smear?
Better to ask that question, when was your last pap smear? And the answer is, it was 10 months ago and it was normal.
Okay, do you have the changes of your skin, or your loss of your hair, or you have the tremor of your hair hand?
So that question should have been, have you noticed any changes in your skin or hair, and have you any hand tremor? And the answer is, actually I noticed some facial hair recently that I am plucking, but in regard to tremor, the patient hasn't experienced any problems.
How about your weight, or now you have the increased or decreased weight?
Question should have been, has your weight changed recently? And her answer is, I have gained 15 pounds over the past year. Now that completes the taking of the patient history, and in the next stage the doctor is going to give the patient a physical examination. Before doing this, again, he has to follow proper procedure. Wash his hands first, ask the patient permission to start the exam. He could say something, for example, like, I'm going to examine you now, or do you mind if I examine you now? Make sure the patient is using respectful draping. Draping means clothes, and in a hospital setting the patient would normally be wearing a hospital gown. And finally, if the patient shows any pain, not to repeat those maneuvers. As always, the doctor is not only being tested here on his medical knowledge, but also upon his behavior and attitude towards the patient. So that is also quite important. In the next part, we'll continue with the physical examination.